Greeting from ECS Heart. I'm Dr. Nooshin Bazargani. I'm cardiologist in Dubai. I also lead the cardiovascular disease prevention group of Emirates Cardiac Society. I hope that this small message can bring your attention to a very important factor or point in your clinical practice, and that is the cardiovascular disease in women. Cardiovascular disease is women like in men. It always goes back to recognition and early control and treatment of cardiovascular risk factors. But in women, we have two different categories of cardiovascular risk factors. We have the traditional cardiovascular risk factors, and we have the emerging or enhancer cardiovascular risk factors. The traditional risk factors are hypertension, diabetes, hyperlipidemia, tobacco use in any sort or any kind, shisha, cigarette, midwah, and also if the patient has family history of ischemic heart disease, if the patient is menopause, because menopause itself would result in higher cholesterol, higher triglyceride, and lower LDL. And of course, not to mention obesity and physical inactivity. On the other hand, we have the novel cardiovascular risk enhancer that recently has been recognized, and it is specific for women. And that is, for example, if your patient has a gestational diabetes. So it's very important when you take history, you should ask about the pregnancy, the gestational time and the pregnancy outcome. So both gestational diabetes and pregnancy-induced hypertension and preeclampsia, they all make your patient at high risk of developing cardiovascular disease. Connective tissue disease, specifically rheumatoid arthritis. If your patient has rheumatoid arthritis, the increase of developing cardiovascular disease is increased by threefold. If your patient has premature menopause, if your patient is suffering from depression or mental health. So all of the above may not be that much clear or recognized in our routine evaluation for detection of cardiovascular disease, but these are the points that recognizing them early will make you to look more for the development of cardiovascular disease, and we make you to be more aggressive in the controlling of the overall risk factors for cardiovascular disease for your women population. Thank you.